The muscles used during knee flexion are the biceps femoris, both the long head and the short head, the semitendinosus, and the semimembranosus. For grades 3, 4, and 5, which are against gravity, the patient is lying prone with their knee in a neutral rotation at approximately 90-degree flexion. To perform these grades, you stabilize the hand on the posterior femur, stabilizing against the mat. Put the resistive hand on the distal posterior tibia, just proximal to the ankle, and the force application direction is against flexion. For grade 5, the patient holds in maximal resistance. For grade 4, the patient holds against strong to moderate resistance, and in grade 3, the patient completes full range of motion without resistance. Try to kick your foot towards your bottom for me, please. Thank you. And now I'm going to move your foot, and you're going to try to keep it in this position while I apply force. So, okay. This is a strong force, and this is a maximal force. Okay, please relax. Thank you. Grade 2 out of 5 is where gravity is minimized. The patient is lying on their non-test side while their hip is in a neutral position. The patient completes available range of motion laying on their side. Stabilization is supporting the thigh and lower leg. Please drag your ankle to your glutes. Please relax. Good job. For grades 1 and 0, gravity is minimized, so the patient is lying across gravity just like in grade 2. The patient is side-lying on their non-test side with their hip neutral. The therapist supports the knee in a partially flexed position. The muscles that the therapist is checking for palpitation are the semitendinosus muscles, the semimembranosus muscles, and the bicep femoris at the posterior knee. These muscles are in the posterior thigh region. For grade 1, the patient has palpitation but no visible movement. For grade 0, the patient has no palpitation. The compensatory movements of hip flexion are hip extension and pelvic rotation off of the mat.